Important things you should know. I can't read it either, so for visual purposes, I am not here to give you any legal or tax advice. I cannot do that. I am a certified financial planner, but when it comes to legal and tax advice, you must consult your tax advisors and your legal advisors. I'm not here to sell you anything. If you want to have a conversation and dig deeper, again, leave your contact information, but this is for educational purposes only. Next. All right. Skip that, please. So, $388,000. Ma'am, if you have $388,000, don't answer it. Because if she does, we're going home with her. Raise your hand if you have just $388,000 laying around. Some of y'all know more folks in your business with you. Even if you haven't, if someone asks you to write a check for $388,000, is that just like going to buy a new purse or a truck? That's not the same. That's about the average cost that a U.S. retiree will spend from the moment they retire to the moment they pass away. $388,000. That's a house. We can go out there to Marion and put it for $388,000, or get a nice house with bricks. So, 7 out of 10 adults said that their number one fear in retirement is healthcare costs. There is nobody subsidizing your healthcare like at your job. And here's the deal, and I'm saying this, I'm telling my business. I have 2 appointments Friday with specialists. I have to go see an eye doctor, and I also have to go see a foot doctor. Nothing's major, don't text me and you're all right, man, I'm okay. I might have to have glasses. I'm looking at screens all day long. And so, when you go to specialists, that's not the same as a primary care, right? Co-pays, treatments, come back in 3 weeks and get this shot every 3, So, as we progress in age and as we decline in healthcare costs rise. Next. Today we're going to talk about the current state of healthcare costs. We're going to understand healthcare costs in retirement. We're going to create a plan to address care costs. Next. So, raise your hand if you would like to invite me over for some steaks. Ribeyes. Why are you laughing? Because beef is what? Very high right now. What has caused the price of beef to go up? What's that I word? Inflation. So healthcare costs are nothing different from any other good or service. The costs continue. And anything that is essential that everyone must have, those things typically go up quicker than others. Okay? We have to have healthcare. You can't put SAS and take Robitussin for everything. We have to go see specialists. We have to have procedures. So inflation has driven the cost of goods and services. But healthcare, you can see these numbers, has risen more than double. From the beginning of the millennium, January 2000, until when this was created in June 24, healthcare costs went up 121%. Okay? And it's not going down. Next slide, please. Firms are not offering health care at an alarming rate. So if you're fortunate to be still working, you want to take very good advantage of your health care plan. And even some of you may remember when you were working, it still seemed like you were paying a lot for health care costs. So even with those of us who may be still working, healthcare is still a major expense. Next. So let's see here, this is like an average annual spending of healthcare and kind of how it's broken down. 32%, the majority of the average healthcare recipient is going to spend money on outpatient care. Things that don't require, you staying in the hospital. About a quarter is on medication. I've seen people make decisions. Should I get this pill or that pill? Can I afford a refill? 28%, about 30% of your annual healthcare costs are spent on professional services, co-pays. So, as you can see, the major drivers of healthcare costs are outpatient services, professional services, and prescriptions. Next. Here's some surprises. So my stepdad went to the mailbox the other day, and he got something out of the mailbox, and he was like, "Ooh!" I was like, "What's wrong with this man? Can I get $20 as a check?" It was his Medicare card. How did you feel when you got your Medicare card? That red, white, and blue, baby. How did you feel? Just think about, you realize I'm 65 years old. He was excited. I've never been excited getting healthcare coverage. I don't know what I'll feel like when I'm 65. But there was some very strong excitement. He felt, I guess what it was, you worked all these years, you've been seeing FICA and all this come out of your check, and you never were able to touch that money, and you've been, raising your kids, and now, you're getting a return, in a sense, on what you put in. I think, is that kind of what that feeling is? Is that why people are excited? Tell me, baby, I'm 33, I don't know, tell me. He was very excited, but here was the thing that I had to tell him. It's still not free. Bubble busted. Still not free. So let's talk about it. Next slide. Next. I told you we were going to skip slides. Nearly 3/4 of people wish they had better understanding of Medicare coverage. Do you all feel you fully understand Medicare? Oh, let's see if we can help. Next. So let's talk about who's eligible. Okay, any individual age 65 or older is eligible if they collect Social Security or railroad retirement benefits. You must be a U.S. citizen or a permanent resident having lived in the U.S. for 5 years in a row prior to applying. Anybody under 65? Okay, you gotta wait, baby. You gotta wait. Those of us 65 and older, we have arrived. Next. All right, 7-month enrollment period. You have 3 months before you're 65, up until 3 months after you're 65. Oops, forgot. To enroll. There's a 7-month window. So, my birthday is January 30th. Aquarius. When can I start my enrollment? 3 months before would be, my birthday is in January, let's go back, December, November, and then 3 months after, February, March. Okay. Next. So if you have siblings, colleagues, nieces, nephews, and you know they're approaching that age, let them know. Even if you've already reached this, let them know as well. All right, if you work past 65, you can delay Part B. You can delay your Part B enrollment if you are still working. How many of y'all do that? You want to, if you're still working, because believe it or not, I'm not going to assume everybody's the same generation, but everybody here is kind of a baby boomer, booming around in the 50s, 60s, Cyclops days. Let me say this. You want to, a lot of them are not necessarily retired. There are people in the workforce well into their 60s because they're young. Y'all are younger and you're healthier and you have that vitality and you're not ready to go home yet. So we do see people beyond 65 still in the workforce. And if so, you want to compare your coverage options using to see if it makes sense to continue on your employer plan or to use Medicare. It's very important. Don't raise your hand because I don't want to tell your business, but this is very important. Healthcare savings accounts. If you have a healthcare savings account, an HSA, it is important that you stop contributing to those accounts before you enroll for Medicare. You cannot be in Medicare and contribute. If you don't know what an HSA is, it is a health savings account. You save for healthcare expenses on a pre-tax and post-tax. It's the only account, investment account, that has 3 tax benefits. You can buy Band-Aids, you can pay for radiation. That's just how broad the spectrum. Long-term care is something that you should look into. If you are contributing to those and you're close to Medicare enrollment, you want to stop those contributions. You can be penalized. Something you learned? Next. You have 2 options for Medicare. You have original Medicare, Part A, Part B, Part D, and Medicare. Let's talk about it. What does Part A cover? Hospitals. Part B covers what? Specialists going to the doctor. Preventive things like routine. Oh, I got a cold. So Part A, hospitalization. Part B, medical insurance. Go see the doctor. Part D, think D for what? Drugs. Don't do drugs unless they're prescribed. We tell children, don't do drugs, but before we leave this world, we're going to do a lot of drugs. Isn't that crazy? I tell jokes, you can laugh. But think D for drugs. It's not included, people. It's not included. That is something that you have to pay for, okay? Medicare, because there are co-pays, deductibles, and surprise expenses, we have a Medicare as a supplemental insurance to help do what? What does Medicare do? Fills in the gaps. Because we can't go put in overtime in retirement. There is no picking up extra hours. There is no bonus or raise. We have a fixed income. And I have to pay $388,000 in health care before I die. So when these surprise bills and things come up, I have a supplement to do what? Fill in the... Is this making sense? And then if you don't want to fool with all those different parts, you can do Medicare Advantage. And we're going to talk about the pros and cons of that. But Medicare Advantage is offered through private insurance that is approved by Medicare. So Part A, B, D, and Medicare are through government. Part C, private insurance approved by Medicare. And it tends to be more comprehensive. Part C coverage tends to be more comprehensive and provide more services. However, as we will see, there are some pros and cons. Next slide. So, remember when I told my stepdad when he got his Medicare card, what did I tell him? It's what? It's not free. So let's talk about that. So, you still have hospital deductible. You still have daily co-pays if you go into the hospital. You still have co-pays if you go into a skilled nursing facility. And while I'm on that subject, there's another thing I got to tell you all. I need everybody to look at me because this is very important. Medicare does not agenda. Medicare does not pay for long-term care. You need to know that. That is a huge misconception. All right? Part B. Part B is the going to the doctor, specialist. There is a deductible. And then there's a co-insurance payment of 20%. So Medicare will pay 80, you have to come up with 20. So if it was a cost that's $100, how much is Medicare going to pay? $80. And how much do I pay? If it's $1,000. You see the okay? Very important that you know that there are deductibles. What is a deductible? Can I tell you what a deductible is? It's the insurance company's way of making sure you're not faking it. Seriously. They want, because you want to file this claim, okay, you need to come up with at least 1,000 on this, at least 2,000 on this, at least 500. This is their way of making sure you're not faking it. That's a funny definition, isn't it? But that's what it really boils down to. Next slide. Okay, good. Here's an example of premium. Your premiums are based on your income. Did you know that? Irma. You raise your hand if you know somebody named Irma. Everybody here knows Irma. Income-related monthly adjustment amount. That is the amount your Medicare premium will be based on your income. So do you know Irma? Do you know Irma? Do you know Irma? So when you pull money out your retirement accounts, I want to fix my bathroom up. It's going to show up as income. Did you not know that? When you take those lump sums and you go back to work or anything that shows up as income, it can affect your IRMA, your income-related monthly adjustment amount. Right now, if you are single, make $109,000 or less, your Part B is $202. If you're married, it's $218,000. It's kind of low. If you make over $500,000, your Part B is $700. So you want to be very careful in retirement when you do things that show up as income. You certain accounts, when you touch them, the IRS looks at it as income. Be very careful. You got to be careful. Because it could increase your income, and I don't have y'all in here balling. So you understand? We follow? Next. In a row. What's not covered? Part B. Dental care is not covered. Vision is not covered. Routine hearing. Hearing aids. Can you hear me? Holler if you hear me. Long-term care. Alternative medicine like chiropractors. How many of us take cruises? You get sick over there in the Bahamas, you better have some insurance because Medicare Part A and B will not work outside of the U.S. or its territories. So think about that when you book your Carnival cruise next time, okay? All right, non-emergency transportation. Had a call this week, DeVon. My mother cannot walk. We got to get her to the doctor this week. Can you call paramedic? You're going to pay out of pocket. Very important. Next. Supplemental coverage, Part D, we talked about covered drugs. Medicare Gap covers out-of-pocket costs, but it only pays for services typically approved by Medicare. Next. What Part D covers? List of approved drugs, everybody plans. Coverages change every year. Premiums vary, and they are subject to who? Who's our aunt we just met a minute ago? Irma. Ain't Irma. Irma Jean. Irma Jean, something else, she'll raise up your premiums. Better watch those ATs that come around and raise your premiums. Next. Let's see. So let's talk about Part D. There is a deductible. There is a catastrophic provision that once you reach a certain amount, you can qualify for catastrophic coverage. Sometimes in healthcare, it's not just old author. My grandmother used to call arthritis old author. Oh, I miss her. Sometimes stuff is a little bigger than old author. Sometimes it's like chronic and critical. And so medications and treatments might skyrocket. So there are provisions to help with things like radiation, chemo and things that can get or surgery. So you want to, if you are reaching those caps, you want to make sure you're doing your research about catastrophic care. Next. Let's talk about Part C. So, Part C, people like Part C because it includes things like hearing, dental, and vision. But here is kind of the difference. You have managed care. So the premiums sometimes are lower, which people like. There are other services like dental, vision. Sometimes we might have to put us a little help in our mouth to eat the chicken. It's okay. But it may not be covered with your Medicare. So some people like the Part C because it's included. You need a little help hearing sometimes. I might end up with glasses. Some of y'all, I can't see you right now. You look good though. I was if y'all want to know how bad I'm struggling to see up here now. Oh my God. But anyway, one thing about Part C plans, however, they're managed, which means, in a long story short, your favorite doctor may not be in your plan. We build relationships with these people. My clients, they're like my aunts or my grandmothers or my grandpas and like my big brothers. Like you build relationships. How many of you all can write down name your favorite doctor? For me, it was Dr. Siddiqui. I was a Medicaid baby, and we went to Dr. Siddiqui over there off the highway. He gave everybody the same prescription, but he was so nice. So you build relationships with these people, and if you have been going to my grandmother went to Dr. Woods for her eyes on Highway 39. You ever remember? Woody Davis, I think that was his name. She was going that man for years, and you couldn't talk her out of it. But if your plan, you switch plans, you don't sign up for the right one, they may not be in that network. And that's one of the biggest draws of Medicare C, the comprehensive, is you have a very tight-knit network. All right? It's best for those things, an alternative Part A and B. If you're cool with the doctors in the network, it could be a benefit, but you just want to be careful. Next. Switching plans. Okay. This is very important. I need to read this. You can go from original Medicare, Medigap to Medicare Advantage during open enrollment. During what? You can go from Medicare Advantage to a different Medicare Advantage during when? You can do that without having any health care checks, without any underwriting. Say underwriting. What is underwriting? Again, the insurance company want to make sure you ain't faking it. So they go through this, whether it's car, life, disability, accident, any type of insurance, they are going to go through this process to see if they can get a lot of premium out of you for a very long time because you're not high risk. That's how underwriting is. They're making sure that you're not too risky to provide this coverage. So if you go from original Medicare plus Medicare to Medicare Advantage, or from Medicare Advantage to Advantage, if you're going out of the original Medicare system, you can be guaranteed coverage without underwriting. However, if you go from original Medicare to original Medicare and a different Medigap plan, let's say you change that supplement, you subject yourself to, what's that new word? Underwriting. So if you're changing supplements, you might be subject to underwriting. If you're going from, I don't like this Medicare C, I can't see my favorite specialist, I'm going back to A, B, D, and a supplement. Next slide. Long-term care. Since you're going to laugh, what did we learn about long-term? You were supposed to write it down. See, I don't have good students. This is a good student over here. What did I tell y'all to write down? Oh, I got to stay in the camera. Stay in the camera. Stay in the camera. Stay in the camera. Long-term care. Next. 80, well, let's go back. Let's go back. This is a good one. 82% of people want to stay at home. You done paid that mortgage for 30 years. They said, I'm not hauling you off somewhere else. People will, one of my great-grandmothers, when we told her she was going to have to go, she was like, oh no, man, I'm going to be gone in 30 days. Went home. She was not leaving her house unless a hearse was taking her out. And she stood on business. Because that's where you build your memories. You know where your stuff is. You know how you got things fixed when grandkids come over. You don't want to leave. You want to die when you want to die. Right there at home. Next. So, bathing, dressing, eating, transferring, toileting, continence. Those are things we take for granted. You all walked in here. Many of you got in line to eat. Some of us, it was a little hot, we need to sit down. And you know, some of us, hey baby, bring me one of those plates. Okay? But if some of that, if you need to use the restroom, you can go. Some of us, we might have to run because we might be somewhat incontinent. Those are daily living activities, okay? And you have a higher risk for long-term care based on your age, your sex, your marital status, family health history. Okay? Very important. Next. We ease on down the road. What did it say? Read that. Read that out loud. 1, 2, 3. Let's do it like the choir. Come on again. Your children are working. Those grandchildren are 20-something years old and they're probably you barely hear from them. What is your plan for long-term care? Many of your children go to the same doctors you do. If a nurse is getting paid $30 an hour to work, how much you think you gonna pay for them to come to your house? Oh, that kid, your pastor can do this. Services include, what does it include? Skilled nurse facility for like a few days. There is a minimum stay that Medicare will pay in a skilled nursing facility for rehab. That's how they look at it, rehab. But after that rehabilitation, very important. Next. Let's create a plan. You got to look at this is where we advise people to have relationships. As we're getting ready to close, to have relationships with professionals. Because to come up with a plan, you need to know what you have. You need to look at sources of funding. How will you pay for these supplemental services? How will you pay for these co-pays and deductibles? What are you going to do to ensure that you can stay at home? Or if your house is too big, you want to downsize, you can go to a retirement center or an assisted living. You want to assess your assets and look at where your income is coming. Very important. And if you're not able to do that alone, get a professional. Okay, next. We talked about healthcare savings accounts. They're like an IRA for healthcare. There's a triple tax benefit. The money you put in them is deductible. The money you take out is tax-free if it's for healthcare. If you're not working, you can't do it. Next. Next. Now, a couple things to be mindful of. Inflation is not going to get better. It might be a little reprieve, but costs a bunch of riders. Okay? Medicare has many associated expenses. What did I tell my stepdad? It is not what? Okay? Long-term care. They used to sing this little song at church. Lord, I'm striving, trying to make 100. 99.5 won't do. You get to be 99.5. Somebody gonna have to help you strive. So if you trying to live and enjoy longevity, you cannot. And I'm speaking from experience. I loved me some Nellie Moore. That was my grandmother. She's buried right next door. She needs some flowers. Anybody have any flowers in your car? She needs something else about them flowers on her husband grave. I ain't been out there for a while. So she got some flowers. Please give me some flowers. But anyway, I could not leave college, stop work, and give her 24-hour care. I could not physically do it. Financially, I couldn't do it. Mentally, because she was in her right mind, I could not do it. And sometimes people will talk about, y'all put your grandma in a nursing home with a quickness. She wanted to live longer. She wanted better health care. You look at her visitor book, she had more visitors than the White House. I would go there at 10 o'clock at night, buzz me in. I knew every shift, they knew me by name. We were the favorites out there. It is okay to go to a facility if you can't help it. Don't let anybody tell you different. You just have to check on them. You have to be present. You have to have a relationship. Because once they know you, and it doesn't make you less than a child, less than a spouse, less than anything. Don't you break your back trying to bathe it. People will try to make you feel bad. And I can't say what I told them because I'm in a church gym, but don't let anybody make you feel bad. But on your level, this is the most important thing as I close to ask questions. You gotta have a plan for long-term care. You have to because it's expensive. I want to thank you all. I gave you, if you don't, real quickly, come on, Trevor. Trevor is the managing partner, one of the managing partners of the Piedmont Group. Technically, he's my boss. Although we're independent, and we're all our own kind of businesses, he's a managing partner and our unit director. He came all the way from Tuscaloosa, Alabama, to be with us today. I'm going to yield to him to give us a few greetings, and after we'll answer questions.
Everybody give it up for DeVon. Thank you all for coming out. Hopefully this was a good treat, very informative. DeVon is a great partner of ours. And boss is a loose term. We're more than anything partners. But, he does a really good job in the state of Mississippi where he covers. And, look, if you have any questions or concerns or just want a second opinion, he would be somebody I'd trust my family to meet with. So thank you all for coming. And we really appreciate it. And DeVon, you did excellent. So.
Thank you. Thank you. Now, I'm not a Medicare expert, so my answer might be we need to have a private conversation and do some research. But raise your surveys. This is a good time to fill them out. Also, I need feedback. I have tough skin, and I don't want you to just put, you did a great job, baby, your grandma will be proud. I need you to tell me how I can improve. I need everyone to give me one thing that I can do to improve. I don't need compliments. I need improvement. I need everybody to put your name. I would love your contact information. But in the comment section, put improvement. And if you do want me to contact you, on the back of your survey, you can write down things you want us to talk about or questions you have. If you don't want to ask your question out loud, write on the back. Give me your email, your phone number. You can call you back. I'll call you back. I will. And get your question answered. At this time, I'm going to open the floor for questions. Madam. I have two. It's the same thing, it's just a copy. Now, y'all just, let me have another question. Okay. Hold on, let me give you a mic, man. Let me give you a mic. Okay. So, Medicare is a federal program. Medicaid is a federal funded program administered through the states. Medicare, older Americans over 65, disabled. What Medicaid typically is income-based, disabled, income, children, people who are at a certain income level. One thing that we do see, and I'm glad you brought that up, it wasn't on the PowerPoint, is as we do need long-term care. Remember I said that 388,000? If you don't have it, or if you do have it, and you're going to draw it down, a lot of people do get on Medicaid. There are wealthy people right here in Meridian who have arranged their assets and things in certain ways where they are poor or low income, whatever they want to call themselves. If you get on Medicaid, you have to be very careful. You cannot own too many assets. You have to be at a certain income level. And if you do get on Medicaid and need the government's assistance with your long-term care, they can and they have to, by law, undergo a process called Medicaid recovery. They go after your income. They typically let you keep your primary residence, but those rental properties, those extra investment accounts, they're going to force. And guess what else too? Cash value life insurance. They will force you to cash those out. And I've had relatives that had to cash them out, take the premium, run to the funeral home, pay for their funeral home because Medicaid, it's an asset. The cash value in a life insurance is considered an asset. And you can't have but a few $1,000s in assets outside of it. So it's very important. That's why I'm telling you about that long-term care. It's no joke. It's no joke. It can if you want to pass your assets on to your family, you need to have a plan, especially if you end up on Medicaid. Very good question. There is she mentioned a 5-year look back. So let me go ahead and give this house to my daughter and give this over here and do it. They are going to go back 5 years from when you registered for Medicaid. They look back 5 years. Thank you, darling. 5 years. Most of our seniors end up needing that. And so if you have assets outside of your primary residence, you have income sources outside of your primary. And then I see some social workers in here. And we talked about that the last time. Next question. Give me 2 more questions, y'all. Come on, I want to hear. Come on, right here. Hold on. They got to be in mind.
If you purchase long-term insurance, then you're prepared if you should need it, aren't you?
That's a good question. My coffee drinker.
Your income tax.
That's a good question. Do you all know, first she mentioned about long-term care insurance. First of all, many insurance companies have stopped offering it. Do you know why? Y'all the reason why Social Security about to go empty? Y'all living long. Baby boomers was gonna go like 10 minutes. Y'all are living longer, and your health care is more expensive. And they are realizing they lost a lot of money because my grandmother was in a long-term care unit for 8 years. And let me just give you the fiduciary answer to that question. Long-term care insurance helps with long-term care costs. Did I say cover? I didn't say cover intentionally because it's so expensive to get right now that if you do get some coverage, it's going to help bring down the price. But in some cases, it might still require you using your own income and assets to pay for it. But yes, if you are relatively younger and healthy, and you have the opportunity to lock in long-term care insurance, I don't care how young you are, if you have an opportunity and it's affordable, lock it in because it can help you mitigate or reduce having to pay out-of-pocket expenses. Now, there are enrollment limits. You only might get it for a certain amount of years and at a certain benefit. But if the long-term care bill is $8,000 a month, and I'm fortunate to have a policy that's going to give me $4,000 a month, that doesn't solve the problem, but does it help? It helps. So you still cannot rely, oh, I have an LTC policy, and I got it back in 1985. Baby. They're probably trying to cancel that policy. If you do have a long-term care policy, please call and ensure that they have not changed conditions, changed benefits, because they're really trying to get out of that business. One more question and we're done.
Explain reverse mortgage, please.
Reverse mortgages? Okay. So to pay for healthcare costs, to pay for long-term care costs, people often have to resort to using their assets. So ideally, you would just write a check and pay the bill. But if people do not have an adequate income, or if you're married and you have a spouse that, hey, we still gotta live over here. You know, you might be at this facility, but we still have to live. One of the things that could happen, or you could possibly look into if it's appropriate, is a reverse mortgage on your property to help cover. And some people get to a place where their expenses are that high, or they're going through a situation where they have to do that. Before you make those decisions to take out additional mortgages or to reverse your mortgage, please meet with your tax advisor, please meet with your financial advisor, especially if you have intentions for that asset to pass on to another loved one. So, key point, don't just make decisions. Don't just ask your friend what they did. They don't know what they're doing either. You have professionals out here. Yes, you will have to tell your business. Yes, in some cases you will have to pay them. Yes, you will have to make some decisions. But see, one of the, I keep thinking about my grandmother. Lean not to your own understanding. That's not just spiritual advice. That's financial advice. That's emotional advice. That's business advice. It's professional advice. Lean not to your what? Own understanding. All have areas that we specialize in. This lady right here taught me how to write letters. That lady taught me how to read. It's all kind of teachers like lean not your understanding. I appreciate you all real quick. I have some literature for you and some business cards that are up here along with this Pastor Beverly's information. So I tried to speak to as many people as I could, but I have business cards. Take the literature, surveys. If you could take them and put them at the end of the table, that'll help us out a lot. Pass it to maybe one person, and then that one, so everybody will have to store them up and just put them at an end. I want to yield it over back to Pastor